Okay. So as you can see, first contact with patients with system of public health care in modern condition carried out at the level of its primary level. And priorities of healthcare service on this level are improving the quality and availability of this care. What does mean healthcare by simple words? It is conventionally regarded as an important determinant in promoting the general physical and mental health and well-being of population around the world. Primary care is the day-to-day health care given by a healthcare provider. Who is healthcare provider? It is a person who provides preventive, curative, or therapeutic, diagnostic, and rehabilitative healthcare services, systematically to people, families, or communities. It's healthcare provider. Main healthcare organization, World Health Organization, attributes the provision of essential primary care as an integral component of an inclusive primary healthcare strategy. What includes primary care? It includes the widest scope of healthcare, including all ages of patients, patients of all socioeconomic and geographic origins, patients seeking to maintain optimal health, and patients with all manner of acute and chronic physical, including multiple chronic diseases. So very wide spectrum of healthcare providers' activity. Which disease, chronic illnesses are more widespread, more common in primary care practice? There are hypertension, angina pectoris, diabetes, asthma, bronchial asthma, or chronic obstructive pulmonary disease, depression or anxiety, low back pain, arthritis, or thyroid dysfunction. Primary care also includes many basic maternal and child health care services, such as family planning services, and of course, vaccination. Which primary care professionals, patient can provide this care? There are primary care physician, so-called general practitioner or family physician, a nurse practitioner or adult gerontology nurse practitioner, family nurse practitioner, pediatric nurse practitioner, and physician assistant. On this slide, you can see three main key elements of primary care. There are point of entry, coordination of care, and essential care. Let's characterize each element more detailed. Point of entry, so-called first contact of patients with healthcare system. This contact is very important as first impression. A general physician or general practitioner plays in this process the role of gatekeeper or a manager, which can define the further patient's therapeutic, prophylactic, or rehabilitation way in connection, of course, with healthcare system. And all patients can get access to other specialists or to hospital care only through primary care physicians after their examination and consultation. Coordination of care, next. Principle, primary care provider coordinate delivery of care from many sources, organizations, medical, social, economical, and others. They can involve to this process patient advisors, advocates, ensure continuity and comprehensiveness. And also they should base his work on better health outcomes. And they should also be oriented on patient satisfaction as maybe most important result of or criterion of primary health care. And now essential care. Essential care meeting needs to optimize population health. How we can optimize? For answer on this question, we should understand what is population health and why do we care. Here you can see ideal attributes of primary care. This care should provide integrated, coordinating with other services, continuity, or a long-term process of patients follow-up, especially for patients with chronic diseases. Accessibility despite on financial status of patients. As you can see here, remove barriers of geography, financing, race, language, culture, and accountability for both patients and providers. Which primary care tools can help to provide care with more effective results? Clinical guidelines, of course. Information about disease management, case management, pharmacy care management, and other tools. Now let's formulate definition of primary health care. This process of this kind of medical care is essential health care that accessible, scientifically sound first-level care provided by a suitably trained workforce, supported by integrated referral systems, and in a way that gives priority to those most in need, maximizes community and individual self-reliance and participation, and involves collaboration with other sectors or other organizations. In this picture, I can describe example of primary care organizations, for example, in United Kingdom. Blue color sectors of this diagram are primary care. Primary care elements, which include national health system, direct national health system working centers, GP practices, dentists, opticians separately, pharmacists, and patient can choose the kind of care. Primary care trusts or strategic health authorities or Department of Health. And main principles of primary care are information, safety, and quality. As for secondary care level, this level in United Kingdom includes, as you can see, emergency and urgent care, ambulance trusts, national health system trusts, mental health trusts, care trusts. This model also very popular in some countries of Western Europe. Let's characterize main elements of primary health care. There are education, patients' education concerning prevailing health problems and methods of prevention of any chronic diseases and controlling them. Promotion of food supply and proper nutrition. Monitoring an adequate supply of safe water and basic sanitation. It's also an important element of primary health care. Maternal and child health care, including family planning. Immunization, vaccination against the major infectious diseases, such as including COVID. Other elements of primary healthcare: prevention and control of locally endemic diseases. It's appropriate treatment of common diseases such as hypertension and injuries or traumas. Basic laboratory services and provision of essential drugs. Training of health guides, health workers, and health assistants, and referral services. On this slide, I can demonstrate for you a comparison, complex integral assessment of different primary medical care systems in some countries of economically developed countries of the world: Australia, Canada, France, Germany, New Zealand, Norway, Sweden, Switzerland, United Kingdom, and the United States, and Netherlands too. As we can see, according to this ranking, most highest quality of care it was in United Kingdom, despite on health expenditures in United States, the maximum, more than $8,000 for a year. But quality of care in the United States just on 5th place in common ranking. As we can see, almost all positions of primary medical system were best in United Kingdom, except Healthy Lives. Healthy Lives just on 10th place. Healthy Lives, maybe you have studied already this parameter on public health organization department of our university. It's also very important parameter of population healthcare or population health. So we should be oriented on prolongation of this period. On first place for this parameter, Healthy Lives, as you can see, on France. And Safe Care also high in this system, French healthcare system, also very high. In Russian Russian Federation, main principle of primary healthcare, medical care is district service. Each territory which serviced each territory divided on some districts. Each district includes around 1,700 people's population. District therapeutics provides the unity of medical and preventive work and performs consistent application of certain groups. What's the structure of outpatient department in Russian polyclinics or outpatient departments? And department of before doctor examination rooms, when the medical nurse can measure patient's body temperature, arterial blood pressure measurement, recording electrocardiography, provide gynecological examination and inspection of skin and throat. Other departments include procedure room for injections, for vaccination, doctors' consulting rooms, when doctor can provide physical examination, fulfill documentation, and prescribe necessary additional laboratory or instrumental examination. This examination may be performed in diagnostic department, in department on prophylaxis. We can organize the preventive counseling as form of preventive work. which are oriented on early detection of risk factors. Department of Rehabilitation includes different technologies, different methods which can help to restore reversible functional disorders or restore functional abilities of patients. And maybe some medical organization can include health center. Health center, it's the of the risk factors or chronic non-infectious diseases for timely correction and management of these diseases. Family medicine is some modification of primary healthcare provider, which can provide medical services for population of any age, including newborns, and for elderly people. So for all patients of one family, and even big family. So family medicine, it's also a form of primary medical care organization which appears possible by competent preparation of family doctors, working in partner attitudes with advisors, consultants, for which help it addresses in connection with impossibility for itself to answer the concrete questions demanding special medical technologies and certain skills. Who is the doctor, general practitioner? General practitioner doctor who has been last special preparation on rendering primary medical care to patients and members of their families, irrespective of their gender and age. Very simple definition. Main characteristics or principles of GP work. There are preventive orientation of first place. The most important, according to GP point of view, most important in healthcare management is disease prevention, especially chronic disease prevention. Continuity. Coordination of care with other services and specialists, cooperation with some specialists and medical services, orientation on family health, and orientation on the person as a whole organism. Outpatient care includes, in some countries, majority of countries include two sectors, government sector and private sector. Main forms of general practice organization, there are solo practice, then he or she works alone without any doctors, specialists, helpers. Partnership work, when two doctors, two general practitioners can provide primary medical care in one office. Group practice, then combination, cooperation of, for example, 4 or 5 doctors, which can provide medical service, primary care service for more big territory, for more big population. And team practice. Team practice, you can see here a picture which illustrates some team. With team can include or, for example, except general practitioner, medical psychologist, social worker, or rehabilitation workers. So that it will team of GP practice. Main structure, possible variant of structure, GP office, maybe independent office, or including to the structure of territorial outpatient department, and possible in association with the improvingly rehabilitation centers. On this slide, you can see also demonstration of health providers in Malaysia. Primary health care, level of primary care includes health clinics or health centers, 1 cent on 2,000 people of population, or rural community clinics. One on 4,000 population. Here you can see the different forms now of primary care clinics and health centers in rural, for example, in rural area. On this picture, you can see the process of data collection, daily work. Then patient is received by the nurse. The 2 were nurse issues a diagnosis to patient, indicate his name, age, gender, and other important information. Medical officer, point number 3, fills in the sheet diagnosis and treatment. Number 4, picture patient present sheet to pharmacy to receive medication. And point number 5, data entry operator digitizes and submit the data to information system. Now let's characterize main principles of general practitioner work. Where I compromise with the patient and its social environment. They should find this compromise, optimal way of interaction and communication. Social justice rule. Principle of constant perfection of the work or constant improvement. His daily work, his results of his work or her work. Attitude to the specialty. Participation in training, regular participation, each 3 months or each 6 months at least. Keeping of ethics, honesty, and of course, health, individual health, maintenance of doctor's health by regular physical exercise, psycho-emotional maybe relaxation, and participation, maintenance of healthy lifestyle. Now, second part of our lecture will devote to characterization of duties and functions of GP. Main duties are the rendering medical care and urgent and acute conditions, bleeding, shock, coronary syndrome, and other. Well-timed consultation and hospitalization of patients with exacerbation of chronic diseases or with acute, for example, infectious diseases. Carrying out medical and rehabilitational interventions according to his qualifying competencies. Carrying out of examination of temporary disability of patients. Organization of the medical, social, and household care together with services of social protection, mostly only aged to invalids and chronic ill patients. Filling of medical records and accounting documentation. It's also an important part of his work. Important role of GP roles include monitoring patients' health to prevent illnesses, arising illness, diagnosis and treatment of health problems, organizing diagnostics, diagnostic process, prescribing medicines and treatment and rehabilitation regimes, and control of their effectiveness too. Undertaking minor surgery. Minor surgery such as primary surgical examination and inspection and care. Taping of wounds examination and medical care. Referrals to other health providers, such as physiotherapists, such as psychologists, medical psychologists, of course. Referrals to specialists such as surgeons, pediatricians, gynecologists. Referring for hospital treatment. Timely, of course, timely reference to hospital treatment for timely correction of expressed symptoms. General practitioner has an important role in the community in understanding both position, their patient and the family anamnesis, allowing a good insight into how and why health problems might be arising. So he's integrator for all family members. She or he also integrates traditional and more alternative ways of medical thinking. His thinking, his searching process is oriented on the patient's problem. He feels this problem, he should specify it, and he will refer him to a medical specialist for more deep examination, consultation, and treatment, if necessary, of course. Patients may come to specialists only through and after contact, after filtration of their problems through GP. A GP gatekeeper function. As for main tasks of GP work, there are, most important, reducing of morbidity, disability, and especially mortality in community. Now, in majority of the countries, highest mortality based by infectious disease together with infections such as COVID-19. But before pandemic situation, it was on first place, cardiovascular diseases, second place, oncological mortality. He used modern methods, should use modern methods of diagnostic treatment, primary and secondary prophylaxis. Now you can see procedure of ophthalmoscopy, examination for timely detection of arteries, retinal arteries changes. Dynamic prolonged observation he should provide of patients there supporting treatment for patients with chronic diseases such as hypertension, ischemic heart disease, COPD, and others. Other tasks of GP work are responding to medical or health problems presented by patients, including history taking, diagnosis, investigation, treatment, and referral as appropriate. Maintaining confidentiality and impartiality. Commissioning healthcare by connection with medical professionals in the community and hospitals. Other tasks of GPO, promoting health education in conjunctions with other health professionals. Organization preventive medical programs for patients. Providing specialist clinics for specific conditions or for certain groups of patients, such as patients with diabetes, groups for smoking cessation or alcohol cessation. It should meet targets set by the government for specific treatment, such as child immunization. Discussing development of new pharmaceutical products with pharmaceutical sales representatives, distributors. Managing resources to service targets as effectively as possible. Using IT skills. Because it's very important now for maintaining patients' record using specific packages. Electronic documents fulfillment. Keeping up to date with medical developments, new drugs, treatments, and medications, including complementary medicine. Observing and assessing the work of trainee GPs and medical students, and teaching at medical schools or hospitals. It should also maintain a portfolio of continuing professional development activities, participation in different conferences or seminars and webinars now. for constant improvement of his work or her work. Consultation of population for problems prevention and health improvement for patients with risk factors, including recommendations about correction of nutrition, physical activity, dream mode, lifestyle, for liquidation, elimination of occupational risk factors, and full comfortable rest organization. On this scheme, you can see the basic kinds of GP activity. His activity includes prophylactic main big parts, most serious, most important group includes prophylaxis, diagnostics, treatment of the most widespread diseases, and of course, rehabilitation of patients. Other groups, his activity are rendering of emergency and urgent medical aid, performance of medical manipulations, and organizational work. I want to suggest for your work to work without break. I agree, and we'll finish earlier. Please write to the chat. Everybody write to the chat your name, group, and plus as confirmation of your presence on our lecture. Let's characterize main functions and which activity includes each function of GP. Prophylactic function includes organization of sanitary educational work with population, popularization of healthy lifestyle of life, education of patients about their potential and actually affects the risk factors, organization, primary prophylaxis of diseases by correction of risk factors. Formation at citizens of the responsible relation to own health and health of relatives, motivation them and supporting to refusal of harmful habits, rendering assistance in refusal of the alcohol and tobacco use. Attracting patients to health school studies.